Evaluation and management group for page number 18. Are you there, everyone?
Yes, sir.
Okay. Now, first, for example, in a general way, general question, if a patient is in a hospital, what you need to look for? General question. Or if a patient is coming to the hospital, what is the first point we need to look for?
Reason for visit.
Or you can say like this, you are going to see a person who is in a hospital. What you will ask the first question at the reception? You are going to see a friend who is in a hospital. What is the first question you will ask at reception? Understanding my question, everyone? Location. What we need to look for? First, location. Where is the patient? The patient is at inpatient ward. The patient is in emergency department. The patient is in critical care. The patient is in outpatient departments. Understood, everyone? First, we need to look for the location. Where is the patient? Can you see page number 18? Office or outpatient services is there on my screen. That is one location where a physician can provide service to a patient. Like that, you can see the locations. What are the locations? Next, hospital observation services is there. Next, hospital inpatient services. Like that, there are different locations in a hospital. Now, see, for anesthesia, which one we need to memorize to code fastly? What are the points I said? Which one we need to memorize to code anesthesia in a quick manner? Modifiers.
Body part.
Modifiers and the rules. Whereas radiology, key terms. Whereas E&M, we need to memorize code series. Now just write down first one. Office or outpatient services. Office or outpatient services. Office or outpatient services. In that first one, new patient. New patient. Double line 202. And see my screen. Double line 202 hyphen 205. Double line 2022 double line 205. In that B, established patient. Established patient. Double line 2112 double line 215. Double line 2112 double line 215. Next one, hospital observation services. Hospital observation services. In the A, initial services. Initial services. Double line 218. Double line 218 to double line 220. Double line 218 to 220. Next one, subsequent B. In that B, subsequent observation services. Subsequent observation services are subsequent. Double line 224 to double line 226. Double line 224 to double line 226. Double line 224 to double line 226. Third, in that C, discharge. Double line 217. Double line 217. Next, third one, emergency department. Emergency department or emergency room. Emergency department or emergency room. Double line 2812. Double line 2812. Double line 285. Double line 2812. Double line 285. Two eight one two 285. Next one, critical care services. Critical care services. Double line 2912. Double line 292. Double line 2912. Double line 292. Next one, hospital inpatient services. Hospital inpatient services. In that initial, A, initial. Double line 2212. Double line 223. Double line 2212. Double line 223. Subsequent double line 2312. Double line 233. Subsequent 992312 99233. Discharge 99238 99239. Up to here, how many locations I said? How many locations I said? Total how many?
6, sir.
6 locations. Okay. Next one. Preventive medicine. Preventive medicine or annual or wellness examination. Preventive medicine or annual or wellness examination. Wellness examination. Wellness examination. In that A, new patient. New patient. 993812 387. 993812 387. Next, established patient. Established patient. Established patient. 993912 397. 993912 397. Next one. Admission. Next point. Admission and discharge. Admission and discharge on same day. Admission and discharge on same day from hospital. From hospital or from hospital or observation services. From hospital or observation services. Admission and discharge on same day from hospital or observation services. Just put 500. 992342 992342 99236. 992342 99236. Double 92342 99236. 992342 236. Now these are the code series we need to memorize in E&M to code fastly and accurately. Total how many code series? Total how many? Total how many code series? How many locations?
13.
13.
8, sir.
11.
11. Locations:
7.
visit, observation, inpatient, ED, critical care, annual examination. Like this, those are the locations. Total hardly how many I said? 8, right? If inpatient again 3, initial subsequent discharge. Observation again 3, initial subsequent discharge. Like that. Understood? Those are the code series we need to memorize. Why I said to memorize? Just see, have an example. See, we need to manage the time in the examination. To manage the time in the examination, we need to memorize the code series. At least these 8 code series. Okay, question number 17. Can you see here? See, what I will do is, when you memorize the code series, do not read a question first. Try to see the options at a glance. If you see option A, compare to your notes, 9923122234, what I said? 1123122234, what I said?
Inpatient services.
Admission and discharge on same day from inpatient or observation. Option B, if you see 99221, that is the code from where you will get. You can see your notes and tell me 99221.
Hospital inpatient service.
Hospital inpatient services. 99238. 99.
Hospital inpatient services. Discharge.
Hospital inpatient discharge service. Okay. Option C, 99217. 99217. See your notes and tell me.
Observation services.
Observation care discharge. Discharge services. 99218. 99218. From
Hospital
your
observation initial services.
initial observation services. Now, see, when you memorize that code series, first when you see options, by seeing this question, I came to know whether the patient is admitted and discharged on same day, or the patient is in hospital, or the patient is in observation, that I need to look for. Now, a soccer player hits his head during an indoor game and is admitted to observation. Now the location is here observation. Admitted date is 121. Discharge date is 122. 121, 122. Now my first question. Is the patient here is an inpatient or the patient is in observation? The patient is inpatient or observation?
Observation.
Observation. That means no need to look for B option. Then same day admission and discharge, or admitted on one day, discharged on another day.
Another day.
Discharge.
Another day. That means no need to look for A option. What they are asking for you to code? They are asking to code for you admission and discharge. Yes or no? Admission and discharge. Admission, the code is one code. discharge the code is another code. If you look for option C, it is only discharge code. But what they're asking in the question, they're asking about admission and discharge. Then what will be your answer?
D is the answer.
Option D, sir.
That's why I said memorize the code series. Without opening the book, we came to know the correct answer or not.
Yes, sir.
Okay. Now, for example, see why we need to memorize the code series, at least 8. Why I said, you can see here. Can you see question number 21? See the options 99381, 382, 391, 392. By seeing the options, can we know that these code series are present in preventive medicine? You can see in your book what you have written for today. Yes or no? These code series from where you find? Preventive medicine or wellness examination?
Yes, sir.
Yes or no? Now, 99381237. What I said, new patient or established patient?
New patient. New patient.
New patient. 99391237.
Established.
Now you can see. After moving across country, Miss Robbins take her 2-year-old daughter to a new pediatric clinic for annual exam. New pediatric clinic. Now, she is an established patient or new patient?
New patient.
New patient.
Can I look for C and D? Can I rule out? Where I will get answer? From A or B?
A or B.
Now, easily we can rule out 2 options. Yes or no? That's what I am telling you all. Please memorize those 8 code series when you are going before for examination. Understood? Now, make heading. Common rules for E&M services. Common rules for E&M services. Common rules for E&M services. Shobha.
Yes, sir.
You are not attending for classes from almost 3 days, right?
Actually, no. Actually, Friday only I missed the class, and today I joined late.
Friday only. I hope Thursday also.
Yeah, Friday only.
Why? Because I didn't recognize your voice.
Friday only I missed the class.
Okay.
Uh,
Vishnu,
Yes, sir.
can you tell me what is the code series used for a person is admitted and discharged to a hospital on the same day?
992342 99236.
236. Okay. Now make heading everyone. Common rules for E&M services. First write down the rules. I will explain. First rule. Identify the location of a patient. Identify the location of a patient. Example, office visit, ED, inpatient, etc. Identify the location of a patient. Identify the location of a patient. B. That means second point. Second rule. Is the initial location or you can write down like this. Is the initial place of service and treatment ended place of service and treatment ended place of service is same or different? Is the initial place of service and treatment ended place of service is same or different? Is same or different? Next point. If it is different, if it is different, if it is different, code only from treatment ended location. If it is different, code only from treatment ended location. Now everyone see my screen. See, for example, the patient initial location is ED. From ED, he went home. Then what is the location for this patient to code? Patient
ED only.
from ED he went home. Then what is the location? Everyone, ED only. From where we need?
ED only, sir.
For example, a patient initially in ED, the ED physician admitted the patient to hospital. Now, where is the patient? Inpatient. Do we need to code from ED or inpatient? As per the rule?
Inpatient.
Inpatient. Understood. Always we need to look in the question. First point, identify the place of service or identify the location. Example, office, observation, etc. Second point is the initial location. That means initial place of service and treatment ended place of service is same or different. Next, if it is different, code only from treatment ended location. Next point, status of patient. After identifying the location, next we need to look for status of patient. Status of patient. That means new or established patient. That means new or established patient, comma, initial or subsequent visit. We need to find out the location for that. We need to find out the status for that location. Is it initial or subsequent? Is it new or established? Is it new or established? Next one.
Sir, can you repeat this point again, sir?
See, first what we need to look for in a question, place of service. Next one is the initial place of service and treatment ended place of service is same or different. If it is different, code only from treatment ended location. Next point, to that location, we need to see the status of the patient. That means new or established patient or initial or subsequent visit. For example, if it is office visit, how the codes are based on new patient or established patient. If the location is office visit, what we need to look in the question? The patient is a new patient or established patient. If it is inpatient services, then what we need to look for? Initial or subsequent, like that.
Okay.
Next one. For new patient, or you can write down level evaluation. Next point, level evaluation. In that, for new or initial visits, for new or initial visits, for new or initial visits, 3 out of 3 key components, 3 out of 3 key components are required. 3 out of 3 key components are required. Next one. If 3 out of 3 key components are from the same level, 3 out of 3 key components are from the same level, code it. Next point. If 3 out of 3 key components are not from the same level, I will explain all these points. Write down this. If 3 out of 3 key components are not from the same level, 3 out of 3 key components are not from the same level, code to the lowest level. Code to the lowest level. Code to the lowest level. Next point. For established or subsequent visits, for established or subsequent visits, for established or subsequent visits, two of 3 key components are required. 2 out of 3 key components are required. 2 of 3 key components are required. Next point. If any 2 key components are from the same level, if any 2 key components are from the same level, code that level. Any 2 key components are from the same level, code that level. Next point. If any 2 key components are not from the same level, if any 2 key components are not from the same level, code to the second lowest level. Code to the second lowest level. If any 2 key components are not from the same level, code to the second lowest level. Code to the second lowest level. Next point. Time. Next point. Time. Next point, time. Now, how many rules are there? Common rules. First, what we need to look for?
Identify the location of a patient.
That means place of service. After identifying the place of service, what is the next step we need to look for in a question?
Treatment ended service.
That means, is the initial place of service and treatment ended service is same or different? Now, if it is different, what we need to look?
If it is different, code only from treatment ended location.
Code only from treatment ended location. Correct. Next one. For that location, to evaluate an E&M level, what we need to look for?
Status of a patient.
That means, how many types are there? The patients. How many types of patients are there?
New or established.
New
Established the subsequent. For new patients, how many key components are required to evaluate a level?
3 key compounds.
3 key components. If 3 out of 3 key components are not from the same level, how we need to code?
Code to the lowest level.
Lowest level. Now, for established patients or in subsequent visits, how many key components are required to evaluate an E&M level?
2 out of 3 components.
2 out of 3 key components. If any 2 are not from the same level, what we need to do?
Code to the second lowest level.
Go to the second lowest level. Understood, everyone? Then, finally, what we need to look for? One of the key factor is time. These are the points, common rules. Now you can see. You can take a question and tell me from where we can code here. Write down one question. A patient is in ER. The patient is in ER. The ER physician placed the patient in observation status, for 48 hours. Observation status for 48 hours to monitor his blood pressure. Code for ER physician. Sunil, how you will code this scenario? What is the first step in E&M rule? Sunil, what is the first step in E&M rule?
Identify the place and location.
Identify the place of service. Now in the given question, what is the place of service? What is the initial place of service?
Yeah.
Where is the patient initially?
ER physician.
ER. ER means emergency room. Geeta Kumari,
Okay.
the patient remains in the ER or he moved to some other location? Malata. The patient,
Sir.
Yes, sir.
the patient is in ER or he moved to some other location?
We are only, sir.
The observations.
Observation room.
See, patient initially is in ER, but placed in which location? Observation status.
Observation.
Observation.
Now, is the initial location and treatment ended location is same or different?
Different.
Different.
Difference.
Now, what is the rule says?
If it is different, code only from treatment ended location.
Now, what is the treatment ended location here?
Observation room.
Observation care. But what here the people will do, they will confuse. Why? Because they are asking the question to code for ER physician. Yes or no? The people will code from ER. It's not like that. The ER physician placed the patient is in observation status. The same physician is involved in services for the patient in both the locations, in emergency department and observation service. Whatever the ER physician provided service in emergency room, all are bundled or all are included in observation care. We need to code only from observation care. Here we are not coding for physicians. We are coding for locations. What we are coding for? Locations in a hospital. Now, understood everyone this question? Just compare the two rules, what I said in your common rules. First, we identified the place of service. The place of service is the emergency room. Next, we identified the emergency room and inpatient. Emergency room or inpatient. So emergency room or observation. Then as per the rule, code only from treatment ended location. Anyone is having difficulty in identifying the location? First three rules, understood everyone? Three rules. First three rules. First three rules. Now, question number 25. Sheikh Naheem, can you tell me what is the location? Question number 25. Question number 25. Naheem, what is the location?
He is admitted to the hospital from his office.
Question number 25. What is the initial location, Naheem, after reading the question? First, where is the patient initially?
Initially, he is at his office,
Okay.
and then he is admitted to the hospital.
Then the treatment ended in physician office or he moved to some other location in that hospital? The treatment is provided in the physician office or he was transferred to some other location in the hospital? That means is the initial place of service and treatment ended place of service is same or different?
Same.
Same. Okay, that means the treatment ended in physician office itself.
Yes.
Now, can you read the first line?
No, sir.
Can you read the first line?
The physician admitted an 18-month-old infant to the hospital from his office to rule out sepsis.
That means the initial location is office. That means outpatient. From there, the physician is admitted into hospital. That means he becomes inpatient or not?
Yes.
That means from office to inpatient. What is the treatment ended location?
Hospital.
Inpatient. What is the treatment ended location? Inpatient.
Patient.
Admitted into hospital means inpatient. Okay. Everyone see in your textbook. First I will show you the locations. Are you there in page number 18? Everyone, try to see in your books. Are you there? Everyone, page number 18.
Sir.
Now can you read this location name? What is this location? What is this location? You can see my screen. What is this location?
Office or other.
Office or other
Other
outpatient.
outpatient services. If you are finding an office or outpatient services, the status of the patient may be new patient, or you can see in your books established patient. Established patient. Then next one. If the patient is in observation services, then you need to look for either it is a discharge service, initial service, or subsequent service. Then after that, hospital inpatient services, that is another location. Inpatient services. Next one. Admission and discharge on same day. Next one. Consultations. Like that, these are the services provided by a physician to patient. Understood everyone? Now take one more question. First try to identify the location. If you identify the location, 50% of the answer you will get. Question number 41. Who will answer this question? Try to text me. Dimple, you can tell me the answer. Remaining persons, you can text me the message.
Yes, sir.
Location name you can
Yes, sir.
message. Location name, that's it. No need to search the codes. I'm not telling you to search the code. Tell me where is the patient in a hospital. That's it. From where we can go. Question number 41. Only 3 persons answered. What about others? You can see the question now. Vishnu, what is your answer?
Sure, initial and treatment and the service is same.
Same. Okay, that means what is your location in the given question?
Inpatient, sir.
Inpatient. Okay.
Yes.
Now, the physician was called to the hospital floor for the medical management. A 56-year-old patient admitted 1 day ago. That means 1 day ago means what? He is an inpatient. Patient was yesterday. Lungs revealed treatment. How? Patient improving. That means we need to quote from inpatient. Now, if you look with the codes 99218 option A, it is hospital observation discharge code or not? You can see in your book and tell me 99218. It's an hospital observation code.
Yes, sir.
Then no need to look after A. Then B, it is an inpatient code. C and D, inpatient subsequent services, that we need to look for whether it is initial or subsequent. Like this, everyone, you need to understand first where is the patient located, where is the treatment ended. If you understand these 2 points, 60 to 70% of answer you will get. Remaining 30% is based on level evaluation. Now write down the rules. Write down the rules. New patient means a patient who have not received any professional services, a patient who have not received any professional services from a qualified individual, of the same specialty, and exactly subspecialty, within 3 years. Exactly subspecialty within 3 years. Exactly subspecialty within 3 years. Next point. Established patient. A patient who had received professional services from a qualified individual, of the same and exactly with subspecialty, of the same specialty and exactly subspecialty, within 3 years. Within 3 years. Exactly subspecialty within 3 years. Exactly subspecialty within 3 years. What is the meaning of specialty and subspecialty? Can anyone in the class? I will explain this too. See, what are the three key parameters we need to look for? Specialty, subspecialty, time period. Now, how much is the time period? Time period is how much?
3 years.
3 years. For example, my question is, if a same patient is coming after 3 years, then he is a new patient or established patient?
New patient.
New patient. Why? Because the time limit for a patient. For example, a patient came towards me in 2018. Again, he is coming in 2022. The same patient. He is new for me or established patient? He came at 2018. Now he is coming again 2022. New or established?
New patient.
New
New
patient. Why?
patient.
Because the time period is greater than 3 years. That is one point we need to look for. Next point, what I said, specialty and subspecialty. Okay, I will explain the definition through flowchart. You can see here the screen. See the screen, everyone. Can you see my screen, everyone? Are you able to see the flowchart? It is in your textbook, page number 7. Page number 7. Are you there, everyone? Page number 7, everyone. Or you can see my screen.
Yes, sir.
Okay. Now you can see here the definitions. First, regarding study, how we progress in regarding studies. We completed our 10th standard. After 10th standard, everyone will do +2. Yes or no? After that, graduation. Graduation, some may prefer MBBS, some may prefer B Pharmacy, some may prefer BSc, like that. All are graduates only. After graduation, we will do post graduation. In that, we will select a subject which we are interested in graduation, and we will do specialization in that subject. This is our education process. Yes, sir. 10th standard, +2, graduation. Graduation, which is the subject more interested for you, that you will select one subject in post graduation, then you will complete your studies generally. Yes or no, everyone?
Yes, sir.
Okay. Now that post graduation subject is nothing but specialty. The physician who is doing his graduation, that means MBBS, he is selecting regarding heart. That means he is a cardiologist. He is selecting to read bones and joints. Orthopedic, he is selecting, you can say, lung. He is a pulmonologist. That is nothing but specialty. Now, subspecialty. What is the meaning of subspecialty means? For example, you can take, you can say orthopedic. Few physicians in all are orthopedics only, but they are expertise in only hand and ankle or hand and foot surgeries. Some physicians are expertise only in replacements. Understood, everyone? Or if you take cardiovascular or cardiologist, some physicians are vascular surgeons. That means expertise only in artery veins related treatment, like that. Always keep in mind. So the subspecialty, specialty, time period. Can you read now the definition here? Received any professional services from this physician or any other physician in the same practice within 3 years. If I said no, I will become to that physician new or established. You can see the definition flow chart here. You can see the flow chart. If I didn't receive any professional services from a patient, then I will become
New patient.
new patient. If I received, yes, I received, then immediately what I am looking for here? What I am looking for?
Specialities.
Exactly same
Exactly.
specialty. That means previously I went for cardiologist. Now this time also are you preferring cardiologist? If I said no, this time I want to go for orthopedic, then I will become
New patient.
new. That means if the same group of practice S means, then what I need to look for? Exactly
Same,
subspecialty.
exact same
That
subspecialty.
means previously I went for cervicothoracic physician. Now also I am going with the same physician. Yes, then I will become established. If I said no, I will become new patient. That means the new or established patient definition is based on 3 parameters. First one is time period. Second one is same specialty. Third one is same subspecialty. Same subspecialty. Now listen the question and tell me. A patient is in Apollo hospitals, went to cardiology department for the second time. Second time also to the same cardiology department. There are 4 physicians working in that cardiology department. Physician A, Physician B, Physician C, Physician D. Now listen, where is the patient? Apollo Hospital. In Apollo Hospital, what is the department? Cardiology department. In cardiology department, how many physicians are working? 4 physicians are working. A, B, C, D. Now this patient is coming for second time. Initial visit was done by physician A. Physician A is not available. On the behalf of physician A, physician B is covering services to the patient. To that physician B, what he is? New or established? Again, I am repeating the question. Patient is in Apollo Hospitals, cardiology department for the second time. There are 4 physicians working in the cardiology department. Previously was seen by A, now B is seeing the patient. Now to B, he is a new patient or established patient.
Established
patient.
patient, sir.
New patient.
Okay.
For B, he is a new
New
patient.
patient.
Shobha, new or established?
New patient, sir.
Kumalata,
Established patient, sir.
Vishnu,
A new patient.
see, what is the definition says? We are coding for physicians or we are coding for specialty, subspecialty and time period? Shobha, we are coding by physician names or we are coding by specialty and subspecialty wise? How we can decide the new patient and established concept based on what are the parameters? Specialty, subspecialty and time period. Yes or no, Shobha?
Yes, sir. In the exactly same subspecialty is a new patient, sir.
Okay, now you can see here. Previously, he came to cardiology department. Yes or no? This
Yes,
time also he
Yes,
is
sir.
in
yes, sir.
cardiology department. That means specialty became same or not?
Yes.
Now, in that specialty, 4 or 5 physicians may work, but the patient is changing his specialty or subspecialty. He is coming to the same specialty.
Okay.
Same
It's coming
specialty.
to the same
In
specialty.
specialty.
Instead of one physician, another physician may cover the service, but he is a established patient only. If we change his specialty or subspecialty, then he is a new patient. Now, in this scenario, what is this patient? Established patient. Understood, Shobha?
Yes, sir.
Okay, now listen everyone, one more question. Patient initially came for orthopedic in Apollo Hospital. He is coming after 1 year. This time he is going to cardiologist. To cardiologist, he becomes new or established.
New patient.
New patient. Everyone,
New, sir.
why? Because here he changed the
Yes, sir.
specialty. Previously he went for orthopedic. Now he is coming for cardiologist. Like that we will decide new patient or established patient. Now write down the key terms, new patient key terms. And last question, Nahil, can you answer?
Yes.
Patient is,
Sir?
yes, Nahil, yes, yes, please, having any question? Any question?
Yes, sir.
Yes, 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 please.
First mentions like an example
Okay.
when the patient went to the cardio department first,
Okay.
later on the also cardiology,
Okay.
but first time he went for the PTCA and next time for the open heart surgery. Is that
Then he's changing the subspecialty. He went for previously cardiovascular surgeon. Now he is going with a general cardiologist. They will clearly mention. If he is changing the subspecialty again to that physician, he is becoming a new patient.
okay, sir.
Okay.
In the same cardiology department, if it's angio or thoracic, that
Then
will change.
that all will
He
be done
again
in the
becomes a
same
new
group.
patient.
Cervicothoracic physician, then he is an established patient only.
Okay, sir. Thank you.
Is Nahin, the last question for the day. If you answer correctly, we will close the session. Yes, Nahin?
Yes.
Okay. Now listen the question carefully and you can answer me. A patient is there, went to a doctor. You can say in any hospital. The doctor said so many disease conditions. But the patient scared and he came out of the physician office. He thought that he wants to go for a second opinion. He is going for a second opinion. He is going for a second opinion. Now, he will become new or established.
New.
Shobha,
Sir, can you repeat the question again?
patient is going for a second opinion.
Same physician, sir?
See, Shobha, simple logic. If you are going for a second opinion, again, why you will go with the same physician?
New patient, sir, then.
Yes, sir, no, what I am asking. See, I went to a shopkeeper to buy a product. He said 10,000 rupees. But every time I am going with the shopkeeper only. But he told me the price in a higher amount. As I know in the market that product is not costing that much. What will arise in your mind? You will buy the product or you will go for another shop to know about the rate?
Another
price?
shop.
Another shop. Yes or no? That means you are going for what? Second opinion. Then to that shopkeeper again you are a new. But this shopkeeper you are an established. Yes or no? If
Yes, sir.
we are going for a second opinion, we will become new. Sunil, understood why you coded established? Understood now, Sunil? Second opinion means you are preferring another physician. He will become New. Next one, make heading. Only 2 points, you just note down. Initial service means a physician
New patient key
providing.
terms.
Sorry. Yes, Vishnu. Any questions?
New patient key terms.
Initial service. New patient. Okay.
New patient key terms, sir.
Yes. But you can write down the definition. Initial service means a physician is providing on admitted date. Always underline that on admitted date.
Sir, can you repeat, please?
Initial service means a physician is providing on admitted date. Initial service means a physician is providing on admitted date. Next, subsequent means a physician is providing service after admission date to before the date of discharge. After admission date to before the date of discharge. 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 Next point. Key terms for new patient. Key terms for new patient. Key terms for new patient. Just write down. Going for second opinion. Going for second opinion. Comma new. Going for second opinion, comma new. Transfer of total care to another physician. 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 This is nothing but new patient. Next one, established patient. Established patient. Key term is follow-up. FOLLOW. Follow-up care. Follow-up care, comma, established care. Follow-up care, comma, established care. Next one, inpatient. Key terms. Inpatient. Key terms. Admitted, comma, attending physician. Admitted, comma, attending physician, comma, hospital floor. Hospital floor. These are the verbiage used for inpatients. See, just in a glance, I will revise the today's session. We started E&M, evaluation and management. First, I have given, I hope so, 8 locations code series. If you memorize, you will save your time in the examination and you will rule out the options quickly and accurately. That's why I said the code series for you initially. Then for all these locations, there are some common rules. What are the common rules? You need to identify the place of service. Is the initial place of service and treatment ended place of service is same or different? If it is different, we will code only from treatment ended place of service. Then to that place of service, you need to understand whether he is a new patient or established, initial or subsequent. That level evaluation we need to do. That I will explain you tomorrow. 3 out of 3 or 2 of 3. Then code it. And we came to know the definitions between new patient and established patients. Is that clear for you all? Just go through the theory part today's session. Okay, tomorrow I will explain how to evaluate any N-M level and we will go for individual rules. But these are the 5 rules. If you understand, you will code accurately 90% of the questions. Any questions from your end? Any questions from your end? Any questions that I can answer? No question?
No, sir.
Okay, thank you. See you tomorrow.